Hello, and welcome to an evidence-based approach to assessing anemia, a video made in conjunction with the UC Davis School of Medicine. In this video, we'll provide a quick overview of the evidence-based physical exam, discuss an evidence-based approach to physical diagnosis and assessment of anemia, and provide a video of a UC Davis Master Clinical Educator demonstrating high-yield physical exam maneuvers that every UC Davis grad should know, and the evidence supporting them. Hand washing before and after each physical exam has been well studied and shown to reduce morbidity and mortality in the hospital and the clinical setting. So we're all taught the physical exam and the basic tenets of inspection, palpation, percussion, auscultation, and special tests. And we do this typically in a top-down, systems-based approach. But this video is going to take a slightly different tack. An evidence-based approach to the physical exam begins with a diagnostic question. For example, does this person have chronic anemia? To answer the question, you first estimate a pretest probability, which is essentially your best guess as to how likely you think this patient is to have the pathology in question, based on aspects of their history, presenting symptoms, etc. It's generally expressed as a percentage. Using this as your starting point, you choose an evidence-based physical exam maneuver, which, depending on whether the test is positive or negative, will feed back on your original hypothesis, giving you a new post-test probability, as demonstrated in this figure. For example, if you don't think that your patient is anemic, giving them a pretest probability of 20%, but then you discover conjunctival pallor on exam, that really changes your thinking, giving you a much higher post-test probability. How much a given physical exam maneuver changes your pretest probability depends on the sensitivity and specificity of the test, which in this case is expressed as a function called the likelihood ratio. You can see in the figure how a positive or negative likelihood ratio can affect your pretest probability either a great deal, for example if you have a positive likelihood ratio of 10 or more, or barely at all, for example a likelihood ratio close to 1. Let's see how this applies to assessing the patient who may have chronic anemia. So to be clear from the outset, the studies that were referenced for this video dealt with chronic anemia, so they excluded things like acute blood loss and hemolytic anemia as causes. So we start here by estimating our pretest probability, which is our best guess as to whether or not this patient has chronic anemia, based on aspects of their history, like age, presenting symptoms, past medical history, medications, etc. Then we start using key physical examination maneuvers to test our hypothesis. And on this slide, you can see a few select exam maneuvers with their positive and negative likelihood ratios listed. Let's take a look at a couple of the highlighted ones. So, as you can see, most of these, in some way or another, deal with looking for pallor in the patient, which is a sign of chronic anemia. And there are several areas of the patient's body that you can use to assess for pallor. For example, here we can see pallor on the tongue. Here we see it on a patient's palm. Note that using your own palm as a comparison can be really useful in this part of the exam. And finally, we can see pallor in the palmar creases, which, as we'll see, is particularly predictive of chronic anemia. Several studies have demonstrated that palmar pallor in particular is more sensitive and specific than just pallor anywhere at detecting chronic anemia, with a positive likelihood ratio of 5.6 and a negative likelihood ratio of 0.4. Even more specific is palmar creased pallor. So as you examine the patient's hand, you look at the palmar creases and see if there's any evidence of blood flow in those areas. That has a positive likelihood ratio of 7.9. Now, perhaps one of the best studied and validated physical exam maneuvers for detecting anemia is looking at the conjunctiva. And here we need to be careful in our approach. Many studies didn't specify where on the conjunctiva they looked for pallor, but a couple of studies did, specifically saying that they compare the conjunctival rim to the palpebral conjunctiva, which is normally pale in color. The pooled data from these studies came up with a positive likelihood ratio of 16.7 for conjunctival rim pallor for detecting anemia. See here, the conjunctival rim is filled with blood vessels and usually is much more red than the palpebral conjunctiva, which is the part that's the innermost you can see here adjacent to the eye. Well, in anemia, these two parts of the conjunctiva become the same color, both pale, as in these two photos, indicating severe anemia with a positive likelihood ratio of over 16. So here's a table from one of the studies of 320 patients that looked at conjunctival pallor as a marker of anemia. Notice that here they break the likelihood ratios down by hemoglobin value, indicating how predictive the sign is for mild, moderate, and severe anemia. The very high positive likelihood ratio of 16.7 applied to identifying patients with at least mild anemia, defined here as a hemoglobin less than 11. It was less predictive of severe anemia, but still pretty good with a positive likelihood ratio of 4.24. The bottom line from the study is that if the sign is present, it at least warrants further investigation with lab testing, as some degree of anemia is likely to be present. Now, let's take a closer look at some of these physical exam findings using McGee's evidence-based physical diagnosis calculator available for free online. So, we choose anemia from the drop-down menu, and we choose a pretest probability based on aspects of our patient's history, their age, their past medical history, how likely it is that we think they may have severe anemia. So let's choose 40 as our pretest probability for our patient, and we'll choose our first physical exam finding, pallor at any site, which had a positive likelihood ratio of around 4. So if you see pallor anywhere, well then the pretest probability of 40% jumps up to a post-test probability of nearly 75%, significantly changing the way you think about your patient, making it more likely that they have anemia if you see this on physical exam. Now, the negative likelihood ratio is around 0.5, just on the edge of significant, taking our pretest probability from 40 to a post-test probability of around 25%. Now, that changes the way we think about our patient, but doesn't necessarily rule out anemia at all. Finally, let's look at conjunctival rim pallor, which, as we remember, had a positive likelihood ratio of 16.7 for detecting at least mild anemia. So that takes our pretest probability from 40% to a post-test probability of over 90% that this patient has at least a hemoglobin less than 11. Now, the negative likelihood ratio for conjunctival rim pallor was 0.5, not quite as helpful, taking our pretest probability of 40% down to a post-test probability of about 25% that this patient's anemic. Here's a figure from McGee's evidence-based physical diagnosis that illustrates how some of the different physical exam findings we've talked about today influence your thinking about a patient and whether or not they have chronic anemia. In conclusion, let's review 4 take-home pearls from this video. First, pay attention to the lighting in the room. A well-lit room approximating natural light will give you the best chance to appreciate any subtle findings of pallor on your patient. Second, use yourself as a reference when assessing palmar pallor or palmar crease pallor. Third, if you think you see palmar pallor on one of your patients, look more closely and look at the palmar creases, as palmar crease pallor further increases the chances that your patient has a chronic anemia. Finally, take the time to learn how to do a good conjunctival rim exam, as conjunctival pallor is the most predictive physical exam maneuver for assessing chronic anemia, with a positive likelihood ratio of 16.7 and a negative likelihood ratio of 0.6.